Okay, all set. All right. Well, I'm Hayati, and I am, like we mentioned, a fourth-year student in the Oregon State's Veterinary College. And I'm getting ready to graduate in the next month and a half, and then we'll be starting a job in July. So the end is close, and this presentation is just going to be on the basics of pet care. And so hopefully this will be helpful to anyone who is a pet owner or is thinking about becoming a pet owner. And so to break it down, there's kind of 4 sections of what I put together for today, and we can take breaks after each one and kind of discuss if anyone has questions. The first one is about choosing a pet. Then we're going to go into some preventative basics for veterinary care. I've got a few slides on nutrition and then a few slides on training and behavior. And so for choosing a pet, you have to start off with some really basic questions, and it's really about knowing yourself and what responsibilities that you can take on. And so in choosing an animal, the most popular pets in the States are, of course, dogs and cats. And this may seem really basic, but like if you're a graduate student who has to be on campus for 40 to 60 hours a week, and you don't have time to get home at certain times to let a dog out, a dog probably isn't the right choice for you. If you're in a program that's relaxed and you can maybe bring them with you, or you can leave and come back to them, or if you have a yard where they can have a doggy door and let themselves out, then it might be a more appropriate choice. But cats are wonderfully flexible creatures and are really self-sufficient. So especially with a graduate student audience, I think that they're potentially better first pets for folks. And then the question becomes adoptions versus breeders. As a veterinary student and soon to be veterinarian, I've worked in and helped out at a lot of shelters, and there are a lot of animals that need to be adopted. So I am a proponent for adopting, but it's not always the exact right choice for every person. And so if you want a very specific breed or age group, you're probably not going to find that in a shelter setting. Additionally, it's good to be conscientious of the fact that more of the animals in shelters are going to come with already set routines and behaviors. And so you need to be prepared for the potential time commitment that it would take to put training in. And that's still going to be true even if you got a puppy from a breeder. But I think knowing that it's going to take some extra time to break some old habits if you get an animal from a shelter is worth thinking about. If you go to a breeder setting too, I really recommend meeting the breeder and seeing the environment that the animals are being raised in, so that you're sure that you're not supporting some sort of puppy mill or something like that. But anyone have any questions about choosing what animal to get and what sort of setting you should get them from? No questions? Okay.
Oh, sorry, I did have a question. About how much time would you say would go into, I guess, the younger animals?
Yeah, so typically, so you're thinking about getting a cat. For puppies, I would say people typically get young animals, puppies at like 8 to 12 weeks of age. You're gonna get a puppy, and then you should expect, it'd be great if you could spend like 2 or 3 months with a lot of flexible time. So like a summer break is a pretty ideal time to like devote a lot of time and energy into training them. Kittens grow a little more rapidly, but I think still if you bring a young kitten into the household, if you have 1 to 2 months where you're really devoting time and like making sure that the house is kitten proofed for them, is ideal.
Thank you.
Yeah. Okay. So that's really all I had on that. For vet care, all of the slides I've put together on this are about preventative medications, because an ounce of prevention is worth a pound of cure. Vaccines are fairly straightforward. There are some vaccines that we consider to be core vaccines that all animals should have, and that's rabies for both cats and dogs. And then it's also these upper respiratory combo vaccines. And so for dogs, it's the distemper, adenovirus, parainfluenza, and parvovirus. And for cats, it's this combination of feline upper respiratory diseases. After those vaccines, it's kind of dependent on your animal's lifestyle. if you're going to have an outdoor cat, I would really recommend that you get the feline leukemia and feline immunodeficiency viruses, because when they're outdoors, they have the potential to run into other outdoor cats. And these two diseases are spread by bites and scratches. And so if they're meeting other animals, other cats outside, they should definitely have these. For dogs, it depends on where you're taking them. So if they are going to the boarding facility, to the groomers, other dog parks where they're meeting animals that you don't know their vaccine status, I would recommend getting influenza. If they're going to outdoor places where they have access to water, this lepto vaccine is really helpful. Lepto is a bacteria that's spread in water that wildlife have access to in the urine. And so lepto is fairly devastating. So the risk versus reward of having this vaccine is worth it because it puts them into kidney failure. So better just not to play around with that if they have access to outdoor water. And then you guys are in Colorado. And so Lyme's disease is actually somewhat prevalent in the area. So I would recommend Lyme's. And if you're out hunting and in areas where you can have access to snakes, there are rattlesnake vaccines that you can get for hunting dogs. This is another basic that I think all pets should be on. Basically, if they have access to the outdoors, they should have flea, tick, and heartworm prevention. There are some states where heartworm is less prevalent. For instance, in Oregon, we kind of do it by a case-by-case basis because heartworms are spread by mosquitoes and they need to have mosquitoes that live for an extended period of time for it to be transmitted. So there's some argument that maybe if you're in climates like this, you wouldn't need the prevention. But I looked at the Heartworm Association's map of the states, and Colorado definitely has them. So it's worthwhile to do. I did put together a rough cost of what it costs monthly. It's typically about $15 to $20 a month for most combination flea and tick products, and about $10 a month for heartworm prevention. And those could have a little bit of wiggle room depending on what product you use, because there are some combo products like Trifexis where you've got heartworm plus your flea and tick. There are some products like Bravecto, which are once every 3 months. And so the monthly cost is different. But I strongly recommend going with something. The exact brand doesn't really matter. And then to sort of, maybe I'm gonna pull a classic to like drive home the idea that heartworm prevention is impossible or really important. I wanna stress the fact that treating a heartworm infection after it's developed is so difficult. So this is a video from UC Davis. What they've done is cut down to the femoral artery in a cat that has heartworm. And they've put the scope down into the artery up to the heart, which is where these worms live in the right atrium. And then they pull them backwards. And right now they're really gently pulling this heartworm out. And so preventing an infection of heartworm is so much easier than treating it, because once you treat it, your only options for treatment for cats is surgery. And for dogs, you can do surgery, or you can do this like adulticide treatment protocol, which takes months, is extremely expensive, and has potential side effects of death, because as the worms die and break apart, they can cause really bad hypersensitivity reactions in the animals. So it's worth it to invest the money in just never having this happen to your animal.
Can I ask a couple questions when you have a second?
Yeah, go for it.
Okay, cool. So from my understanding, so I have a dog. From my understanding, heartworm is monthly. And then the flea and tick, I think we've talked about doing it seasonally. What are your thoughts on that?
So the heartworm medication, there's a bunch of different brands, which can make it confusing, I think, for owners. But there are ones that are monthly. Those are usually like oral tablets like HeartGuard, but there are also some injectable formulations, which can be once every 6 months or once every year. It just depends on what you prefer and which one you can remember to do. Because if you do it every 6 months, but then you forget to go get the next injection, it's no good to you. And that's fine. And I think it's worthwhile to do that one year round if you're in an area that has mosquitoes year round. Colorado might get pretty cold in the winter, I feel like. And so if you skipped out on your heartworm preventative in like the winter months when you're sure there's no mosquitoes, I feel a little like weird giving that advice, but as long as you're sure that you're going to go back onto the heartworm medications when there would be mosquito season, that's okay. For flea and tick, it's essentially the same advice. Seasonal is fine because you're probably not going to have fleas and ticks in a cold winter month, but you need to remember to go back onto the preventatives probably in like the spring time, because that's going to be when it warms up enough that they'll be around again.
And it's influenza. How often is the influenza vaccine recommended?
So the influenza vaccine is typically annual. There are some boarding facilities that may have like individual, like they'll want like every 6 months boosters, but annual should be fine. And it is a little bit like the human flu too, where there are multiple serovars. And so you vaccinate, it can be frustrating. You vaccinate your animal and then they still end up sick. And that's because we can't absolutely guarantee that even with the vaccine that they wouldn't get it. But it, just like with people, we still recommend it because it decreases their risk, and then it can also decrease their symptoms if they do contract it anyways.
Cool, thank you.
Mm-hmm. Okay. The next thing for pet care, vet care, is stuff that requires anesthesia. And so this is essentially for basic pet care, spays, neuters, and dentistry. I strongly recommend getting your animals fixed. Most people, if they've adopted an animal, will have them already fixed by the time they get them, because shelters typically don't adopt out animals that haven't been spayed or neutered. But if you got an animal from a breeder or from some other like sort of family situation, they may not be. And so a good timeline to have this done is between 6 and 12 months for cats and for small breed dogs. So think dogs that are less than 40 pounds or so. For large breed dogs, so bigger than 40 pounds, it's not an exact rule, but like Labradors, Rottweilers, big Great Danes, they have more long bone growth to do. And what they've found is keeping their sex hormones around for a little longer helps their growth plates close at appropriate times and prevents them from having some orthopedic diseases down the line. And so waiting till at least the year mark to maybe even closer to 2 years marks can be worth it in those large breed dogs, but you're balancing this risk versus reward, because one of the reasons that we really recommend spaying and neutering is, of course, pet control or population control, but also for the decreased risk of developing certain hormonally influenced cancers. So mammary and testicular cancer in particular is much lower in animals that have been spayed or neutered before they go into their heat cycles. And then also certain risks of prostate disease are lower if you've neutered your animal. And then it might be less important to some folks, but you also decrease certain undesirable behaviors that are hormonally influenced, like territorialness, humping furniture or people. All of those things go down if you take away their sex hormones. But we also don't want to do it too early if it leads to orthopedic disease. So doing it at the right time is important. For dental care, this is one of those things where prevention can again be really helpful, because I think we often overlook it as something that impacts our pet's quality of life. But if you have a lot of tartar on your teeth, if you have gingivitis, it's painful and it affects how they feel day to day. And so you can prevent them from getting those buildups in the same way that we prevent it for ourselves by brushing their teeth. A word of caution is that I wouldn't use your own toothpaste to do this, because xylitol is a sweetener that is in a lot of human products, which is toxic to our pets. It causes them to have really, really hypoglycemic events. So it's worth it to buy like a pet specific toothpaste. And usually they're also flavored to make it more tasty for the animals. They come in all sorts of chicken and beef and tuna flavors. And then just take it slow. So don't try to go for a like full brushing all at once, but just get them used to like you messing with their mouth and then putting a toothbrush in there, and then like, you know, keep it to really short sessions until they don't mind it, and make sure you're giving them lots of rewards so that this is something that they don't mind being a part of their routine. People will ask like how often they should do this. It's as often as you can do and like maintain your good quality bond with your animal. So ideally you would do it just like you would do it for yourself, which is every day. But if this is something that your animal hates, it's not worth putting them through that every day, but maybe try to do it once a week or once a month. Every little bit helps. If you can't do it at all, that's fine. I would recommend getting kind of routine dentals for your animals, which your veterinarian can do, but it is a procedure that takes anesthesia. So they don't typically stay still for dental cleanings like when we go into the dentist. So it is a little bit of a bigger ordeal, but it's worth it if you can't keep their dental tartar under control with just brushing. This slide is about pet insurance. Pet insurance is kind of a growing thing that people have. It's still fairly rare for people to have pet insurance. In the US, it's about 2 to 3% of pet owners that have pet insurance. But if you can afford it and kind of budget it into your finances, it is incredibly, incredibly helpful. If you can't afford monthly payments for pet insurance, I would still highly recommend that you kind of put aside a savings account for your pet. This figure here is the average cost of an unexpected ER visit for an animal. It's $800 to $1,500. And so it's really terrible. And I'm about to start a job at an ER in Eugene. And it is the worst thing when someone comes in with an emergency with their animal and then we can't do anything for a preventable or treatable disease because of finances. It's one of the reasons that the field has a fair amount of burnout, because that's really, really morally hard. And it's not something that we want to do. So making sure that you have kind of a savings or pet insurance for your animal is useful for yourself and your pet, but it's also useful for us because we don't want to have to turn away animals who are sick just because of money. As far as specific pet insurance goes, there are about 20 companies in the US, and there are 3 that make up the majority of the market. So Healthy Paws, Nationwide, and Trupanion. I don't have any specific recommendations, but those are 3 big ones. And when you're choosing coverage, most people, again, remember this is like 2% of pet owners, but the people who have it generally are choosing between something that covers accident and illness. And so accidents are going to be things like my dog got hit by a car, but illness would cover if they had like gastroenteritis and they've got diarrhea or something like that. So choosing a plan that covers both of those situations is great. The best thing would be if you could afford to also cover like preventative health, then you wouldn't even have to think about coming in for your vaccines and your annual. It would just all be already covered. But to keep things financially in scale, most accident illness plans, the average cost of that is in the $40 range for dogs, and it's in the $30 range for cats. So if it's something you can afford, wonderful. If it's not, make a savings account. This is my last slide on vet stuff. And this is just kind of picking from the top 20 lists of calls that the Animal Poison Control Center gets. And the takeaway from this for me is that a lot of these things are human medicines. So it's your non-steroidal anti-inflammatories, it's decongestants. I didn't write it on here, but heart medications was also on there, inhalers, like Prozac and stuff, things that should be in your like pharmacy cupboard. And so a great way to prevent ever having to call them to get help or coming to your vet to get help for these things is to just really pet-proof your own medications. Put them up high where they can't get to them, put them kind of under lock and key. And definitely there are some Houdini Labradors who can get into anything, but knowing that they're toxic to your pet and then keeping them far away from them is a great way to prevent it from happening. Other things that are common calls that they get are chocolate, but I feel like pretty much everyone knows that chocolate is bad for dogs. Something that maybe fewer people are aware of are grapes, raisins, and currants. So these are tricky because not every pet is actually going to have a sensitivity to it. It's about 20% of dogs that will have a sensitivity to grapes and raisins, but we don't have a way to predict which ones will have that sensitivity. So the general recommendation is just never to give them as treats, because the ones that do have a sensitivity develop like fatal kidney failure. So it's not something to mess around with. And then xylitol, I talked about this a little before with the toothpaste, but xylitol is really ubiquitous. It's in jams. I think it is in some peanut butter. It's in gum, and it causes hypoglycemic events for the pets, sometimes to really fatal low blood sugar levels. So none of these things should go to your pet. And that is that for that section. So does anyone have any questions about pet stuff, that pet stuff? Okay. Okay, so I have a few slides on nutrition. And for pet food, there are a few things that are on bags that I think that pet owners should pay attention to. Then I think you should also be aware that a lot of it is marketing that isn't regulated by any regulatory body. And so if they have really pretty packaging and it really calls to you, that's fine and wonderful, but know that no veterinarian is judging you based on how expensive your pet food is. No one is judging you on how pretty the pet food label is. The things that we care about are really, really simple. And so on the front of any pet food is going to be a species designator, which just tells you whether it's cat food or dog food. And this is like the super basics that I don't think that many people mess up, but cat food cannot be fed to dog food or to dogs, and dogs food cannot be fed to cats. Cats are obligate carnivores. They also need certain amino acids that they can't make on their own. And so those things aren't in dog foods and vice versa. So they need to be fed the right species designated food. The other thing that I think is really important on a pet food label is looking for the nutritional adequacy statement. And so this is, I took a little like screenshot of one here. And so it'll say the brand of species designator dog food, cat food is formulated to meet the nutritional levels established by AAFCO for, and then it'll be a certain like growth or time period. So it'll be like for puppy growth or adult maintenance or senior, whatever. And that is an important thing to pay attention to. It's in really small font, but, and again, I don't think many owners are messing this up, but there are some things that are meant to be treats and they're not nutritionally balanced and they shouldn't be fed as the majority of their diet. You should be feeding nutritionally balanced food as the main source of their calories and nutrients. And that's really all I care about, except for these next two slides. So there have in recent years been a strong correlation between BEG diets and some heart disease. And so BEG is an acronym for boutique, exotic, and grain-free. And we don't understand the mechanism of action, but there is a strong correlation to this heart disease, which is called dilated cardiomyopathy. And DCM used to be something that we really just saw in cats who didn't have taurine in their diets. But with the increase in like commercial cat kibble, we rarely see taurine deficiency, so they're not really getting DCM. And then it's something that you genetically see in like Great Danes. And now suddenly cardiologists, veterinary cardiologists are seeing a steep increase in DCM, and they think that it's from the increase in popularity of these diets. And so I've included this little graphic, which is from the FDA's like investigation into the link on this. And if you see like the brand of food that you're feeding on here, it's not necessarily like proof that your dog for sure is going to develop DCM, but I would just recommend not taking the risk. Choose something that is grain inclusive, and there are certain brands that we call like the big three in vet med because they have veterinary nutritionists on staff, and those are Hills, Purina, and Royal Canin, and they're brands that we feel do a really good job making sure they're nutritionally complete and also don't have any of the links that we see with these foods to the heart disease. And then the final word on nutrition stuff I have is on raw diets. These are growing in popularity. They're a fad right now. And people who like them claim that they have more nutrition density, and they're also good for dental health because animals that are chewing on bones and stuff have cleaner teeth. But the literature that we have on this don't show that they're nutritionally better. If you did a good job of formulating your raw food diet, they shouldn't be nutritionally less adequate, but they're not better than a kibble. And what they are is a public health risk. Just like why we don't eat raw chicken or raw ground beef, these diets also harbor salmonella, they harbor E. coli and Campi and Listeria, and they are shed in the feces of the pet for several weeks after they eat them. And so if you're really interested in feeding a raw diet, like I guess, but if you have anyone in your household that's immunocompromised, if you have young children who are going to be like putting their hands in their mouths frequently, I strongly recommend not taking the risk and just don't feed a raw diet. So that's it for nutrition. Any questions on that stuff?
I have a question. So my dog is 11 months right now. So pretty soon she'll, I think it's considered an adult once they're one. I guess I'm not really sure. But I assume I'll need to be transitioning her food soon. And then with my cats, sometimes I think he's eating too fast or something's happening, or he's just not a fan of this food anymore, but he's been throwing up occasionally. And so I was thinking of transitioning the cat's food and also eventually my puppy's food. And I'm wondering kind of what you recommend in the process, if you like mix them together and kind of transition them that way, or kind of how that process works.
Yeah, so you're right on track. If your puppy is 11 months, this is the perfect time. Around a year is a great time to start transitioning to an adult diet. And you're also right on track with how you would do it. So we recommend kind of going in quarters. And so as you get to the end of your bag of puppy food, basically feed them like 3/4 of the old food with like a quarter amount of the new food. Do that for a few days, like three to 4 days, and then add like, so that it's half and half, and then 3/4 and a quarter, and then transition all the way to the new diet. And that is just going to help prevent basically upset stomach, so that they're not transitioning to a new diet quickly. For your kitty cat, how frequently is she vomiting?
So I have two of them. One doesn't do it at all, pretty much. The other one, it's probably 3 or so times per week, and it's always in the evening after their dinner.
Okay. And can you describe the vomit for me? Like, is it whole food, or what does it look like?
You can see all the food, every single piece. It looks like it's not chewed at all.
Okay. Well, they're vomiting 3 times a week is more frequently than she ought to. Hey, Lindsay.
Hello.
Hi, welcome to the small club.
Thanks.
Well, so 3 times a week is too many. And so I think that there are a couple different reasons that could be happening. It could be the diet. And so that's worth troubleshooting and switching. But it could also be that she's got something else going on. There are a couple of different reasons that a cat might be vomiting. It could be that she has like inflammatory bowel disease that can cause them to have some vomiting. But if this has been going on for a long period of time and it's 3 times a week, I would take her to the vet, essentially, is my recommendation. Have her have an exam.
Yeah, he has IBS, and he had like calicivirus and all of he's had a really tough little life with all of his illnesses. So
how old is your cat?
He just turned 2.
Okay, pretty young. Well, Pookie just yelled from the other room, parasites. That's another good differential. Yeah, if they have a parasite load, that can cause regular vomiting. And so a really simple rule out would just be to deworm your cat and see if that helps. And then changing the food to would be an easy change to make.
I'm gonna look into that stuff. Thank you.
You're welcome. Okay, so the last section today is going to be on behavior. And so the reason that I'm including it in the presentation is because it really is important to put some time into training your animals. This stuff is from a survey from 2015 with the ASPCA, and there are about 6.5 million animals that go to shelters every year. And on surveys, one of the consistently top reasons that that happens is behavior. So a dog that barks too much, a cat that pees where it's not supposed to, or claws the furniture, things that, oh, so cute. Yeah, and so putting the time into proper behavior training is worth it from the onset. And then I'm going to provide you with basically 2 different formulas for some ideas on how to do training. This first 5-step formula is for fear and anxiety-based behaviors, which is a majority of the bad behavior that we see in animals. And so, for example, this would be like barking at strangers, like who come over to the house, or when you're on walks. It's food aggression, it's separation anxiety. All of those things are fear-based behaviors. And then it's not that you have to do all 5 of these steps. If you do any of the steps, I recommend just the first one at the very least. So IDing and avoiding triggers isn't going to change the behavior. It does nothing to start changing behavior, but it keeps your pet safer and it keeps yourself and other people safer. And so in the example of a food aggressive dog, ways so you would identify that they have food aggression, and then you would avoid the trigger. And so this might mean like feeding the dog in a separate room from the other pets or from other people. It means not giving them treats that last a long time, like bones that they're going to have for hours that might need to be removed from them later on. In the example of a dog that barks at strangers, it means maybe you pre-segregate them to a different part of the house before you have people come over. It might mean that when you're on a walk, you are aware of your surroundings. You see people walking another dog coming towards you when you cross the road. Seems really basic, but it is important for the pet safety. The next things are going to help you do more behavior modification. And so teaching foundation exercises, these are your basic sit, stay commands, watch me. You can use target hands, you can do clicker training. If you've got a new puppy, all of these things can be taught and trained when you go to like puppy training classes. But the important thing is to be consistent and to try to ignore non-compliance and try to reward when they do the commands. Products are important to help you be successful while you're training your animal. So leashes, I recommend going with non-retractable ones because you have better control of the animals. Baby gates to keep them in certain parts of the houses, thunder shirts, pheromones. They have Adaptil for dogs and Feel Away for cats. And then we have a bias against them in society, but muzzles are great. You shouldn't feel ashamed to have to muzzle your dog if it needs it, because if it keeps them safer and other people safer, it's just worth it, and it'll make training easier. Behavior modification can be done in a couple different ways. I've put here desensitizing and counter conditioning, because in my opinion, it's the best, safest way to do training. There are other ways. You can do punishment and you can do flooding, but they carry certain risks for basically breaking your human-animal bond. If you do punishment, you need to make sure the acronym we're taught is ICE, which stands for immediate, consistent, and effective. And if the punishment is all 3 of those things, then that's great. But if it's not immediate, consistent, and effective, then it's probably not helping your animal at all. So desensitizing and counter conditioning is probably something you guys are familiar with, but it's the idea that you would provide them access to their trigger over a gradient. And that can be a time gradient, it can be a distance gradient. So for that, like dog barking on a walk, when people are nearby, you can find a distance where they're not being triggered, and then you slowly start to decrease it, while at the same time counter conditioning by providing them a really excellent reward while they're getting closer to their trigger. And you should do this slowly over time too, obviously. And then the last of the 5 steps is drug therapy. And this is something that I feel like a lot of people skip, but if you have an animal that's got a lot of fear and anxiety-based behavior, it is worth doing. It takes a veterinary visit, and it also takes some money for diagnostics, because we're not going to want to prescribe certain things without having ruled out other medical issues for the behavior. And so that'll, for your expectations, usually be some baseline blood work to rule out things like thyroid diseases and other things that could cause behavior changes. But then they can prescribe a fairly small list of things that can really help with anxiety-based behavior. Okay, this is the last slide. This is different than the 5-step formula. This is the 3 R's, and they are going to be for behaviors that are normal, but can often be annoying to us. And so this is not aggression barking, but like just barking in general because the doorman came, or digging in the yard, or jumping up on people, or play biting. They're behaviors that animals normally exhibit, but that we tend not to like. So the R's are remove, replace, and respect. So remove, I've put basically a couple examples here. So for a dog that jumps up on you, I would remove attention, like turn away from them, and then replace with like a sit, stay, one of your basic commands. Or if they're play biting, you remove your hand, seems really basic, and then replace it with something that's acceptable for them to bite, like their rope toy. For pulling on leashes, you may remove the like neck collar that they're pulling on and replace it with like a gentle leader, one that goes around their nose, as well as providing a heel command. When they're barking, you might remove the stimulus that's causing them to bark, replace it with a quiet command, or provide outlets for quiet play. Digging is a complicated behavior because sometimes they're doing it out of hunting behaviors, or they're looking for a cool place to hang out in the backyard, or they're trying to hide their bone, things like that. But basically removing access to the inappropriate digging area, and then dependent on why they were doing it, replacing it with a cool area to hang out, or a designated area that is okay for them to dig. The third R might seem less important, but it's important because it will help you maintain your sanity while you're trying to train these behaviors out of them. It's understanding that they're not displaying these behaviors out of spite. They're normal, and therefore you need to have some patience as you work towards getting rid of the behaviors. So that's that. Does anyone have any questions on that section?
I, of course, have a question. So you were talking about the ICE acronym and correcting behavior being immediate. So what if, for instance, my puppy does something that's inappropriate, but I don't realize it because it's in the other room, or something like that happens, where she maybe chewed something up, or whatever that is. Should I address it immediately upon noticing it, or because it occurred 30 minutes earlier, it's like I missed my opportunity to really address it, it won't be effective now?
Unfortunately, in that instance, yeah, punishment won't be. You could do the other things, like you could try the 5-step formula and stuff. But yeah, if you try to like yell at your dog at that point, it's just not going to be effective in changing the behavior forward. Yeah.
Makes sense.
So I think examples of things that are punishment for training, but that are effective, are bark collars, because those are going to be always immediate and consistent anytime they bark. The question becomes if they're effective, and that kind of depends on the dog. If you have a dog that's going to bark through the bark collar, then I say that doesn't pass the test of being effective. And at that point, they're just getting zapped and not getting anything out of the punishment. But if it is effective for them, great. They also have, I think, there's citronella spray collars for barking, and those are also going to always be immediate and consistent, and are usually effective. But yeah, unfortunately, for the instance where you find the torn up cushions or whatever, like after the fact, punishment isn't going to be an ideal way of training it away.
Is there something that's ideal in that circumstance, other than
think,
like trying to remove it when you can?
Yeah, but that's difficult because, right, like if they're tearing apart your couch, what are you going to do? Remove your couch? it may be that you have to remove their access to it. So it's something they're consistently doing that might look like crate training them so that when you're not around that they are in a crate, are replacing it. Like you're going to leave for a period of time and you're going to replace their need for play and like activity with like one of those stuffed balls that is going to take them a while to get treats out of and stuff. It's tricky. I know these sort of training behaviors are potentially very frustrating for people because there's not a quick way to make these behaviors disappear. And when they're destructive behaviors, it becomes really frustrating really quickly. So, yeah.
Well, thank you. She's doing better, but every once in a while we have something that happens, and I wish I could talk to her like a human and be like, hey, don't do that again, but it doesn't exactly work that way.
Yeah, I feel for you. Okay.
I had a question just generally, because you talked about briefly about like indoor versus outdoor cats. And so I was kind of wondering like what your thoughts on that was. Like, do you prefer indoor versus outdoor cats? And then also, I guess what your opinion is on like taking indoor cats outside sometimes, because I've heard controversy over that. Kitty.
So that's Banks. Banks belongs to Pookie and she is an indoor cat. So she was an outdoor cat and then she got hit by a car and now she has several orthopedic issues and she is an indoor cat who sometimes gets to hang out on the back patio. As a veterinarian, my preference is for indoor cats. I think it is better for their health. I'm also a birder and I know that outdoor cats have a fairly significant impact on outdoor birds, but I do understand why some people have outdoor cats. It's, I think, a lot more stimulating for them. I think a lot of them really enjoy being outdoor cats. And so I don't have a judgment on whether people have indoor or outdoor cats. I guess to keep it simple, my veterinary advice is to have an indoor cat, but if you have an outdoor cat and you do a good job of keeping them up to date on their vaccines and deworming them, they probably really like being outdoors.
Making sure they're fixed.
Yeah, spaying and neutering them for population control because cats can have a lot of babies really quickly. Yeah.
And then do you have any sort of recommendations for, I guess, keeping your indoor cat like enriched and stimulated?
So playing with them yourself is a great option. And the recommendation that our behaviorist gave us was to actually like set a timer for like 5 minutes because you feel like 5 minutes isn't that long. But when you're like playing with like a ribbon or like a little laser light or whatever, it can be quite a bit of time. And so setting time aside, even if it's just 5 minutes to do that with your pet is great. And then they also have, I have a lot of classmates with cats. And they make a lot of different toys. There are these like little layered like plastic things with balls that can like spin on them. Big likes that. Yeah, just trying toys because not all cats are going to like the same toys. I pet sit for this lady who has a really wonderful like outdoor patio that's a catio because it's all like screened in basically, and so her cats have free access to that, and I think that is quite stimulating and enriching for her cat. But I also know that not everyone lives in a place where they can make a catio, so doing the best with what you have is just fine.